Okay, breast cancer and women of African descent is an event taking place this Saturday, the 29th of May, 2010. And in the studio to tell us more is Sister Abby, she's called, but she'll tell us her full name in a little while. And she's come on behalf of Black History Walks. A very good morning to you, Sister Abby. How are you?
Good morning, everybody. I'm very well, thank you.
I must ask, why do they call you Sister Abby?
You're
not a nun, are you?
I'm definitely not a nun. I think it's just a little bit of a respect thing. But
Okay.
yeah, most people call me Abby. So my full name is Abby Ajose Adiogun.
We'll sit with Abby.
Yeah, you can.
So, Abby, the title of the event, I mean, it suggests to me that there are perhaps more cases of breast cancer in African Caribbean descent than other communities. Is that the case?
Well, no, that's not the case. But when you think about breast cancer and Black women, there's actually good news and bad news. So the good news is that Black women are less likely to develop breast cancer than their white counterparts. But unfortunately, I think this is kind of overtaken by the fact that when we do get breast cancer, we have a worse outcome. So percentage-wise, more Black women die of breast cancer than white women.
So why are we less likely to even contract breast cancer?
It's probably down to a little bit of genetics. That's why we're less likely to develop it. But also there's the fact that white women and Black women get different types of breast cancer. So it's all down to a little bit of genetics, a little bit down to environmental factors as well.
Do you know, it's interesting. I just thought breast cancer was breast cancer. I didn't realise that there's a difference.
No, that's the thing. There's a lot of misconceptions. Breast cancer is not just one disease. There are many different types of breast cancer. So there is a lot of misconception around that.
Okay. Now, 2 days ago, I spoke with a Dr. Mark Messina, who is the former programme director of National Cancer Institute. And he was talking about the benefits of soya in counteracting breast cancer. Are you aware of this 20-year study that took place?
So I think there have been several different studies that have been conducted on soya and breast cancer. So my understanding is that it's not really conclusive at the moment. We can't definitively say whether soya is beneficial or not. My understanding is that some studies have shown that soya is protective. Other studies have shown it actually stimulates breast cancer. So it's not conclusive. And I think a lot of the issues is to do with soya contains a chemical called phytoestrogens. And it seems that in materials and foods that we eat that have been processed, this has been concentrated. So you have a high concentration of phytoestrogen. And in those situations, they feel it's possible that could stimulate breast cancer. But there are a lot of products that contain natural kind of soya and phytoestrogen, so fruits and things, and that's in a lower concentration. And it's thought that at a lower concentration, it's possibly good, but at a higher concentration, it's not. So at the moment, my understanding is that it's inconclusive at the moment.
It's a pity, obviously, that Dr. Mark Messina is not here because he was championing it. He's been part of this study for many, many years. And, you know, he felt it was conclusive. And it's definitely happened. And he also says that evidence suggests that eating small amounts of soya, like one serving of milk through childhood and adolescence, reduces breast cancer by, listen to this, between 25% and 50%. I mean, that's incredible.
That is incredible. But yeah, I'm a bit hesitant. I'm not quite
right.
From my reading and what I've been exposed to, it seems it's not quite conclusive just yet.
Okay.
But possibly his study, as it's at lower concentrations, I probably do agree with that. Lower concentrations would probably be protective. Yeah.
So tell us about this event. I mean, what brings you to actually organise and, you know, champion this event that you're hosting this Saturday?
Okay, so this event has been organised by Black History Walks. They've actually invited me to speak at the event. Black History Walks, they organise monthly events around all kinds of particular issues affecting the Black community. So they organize walks, talks, films all throughout the year. So they were very concerned about the health issues of Black people. And one of the issues that came up with my discussions with them is the issue of breast cancer. So that's why we've decided to organize this event on Saturday. So it's going to be on Saturday at 3:00. And basically it's going to focus specifically on Black women and breast cancer. We also have a breast cancer survivor called Marina Ramey. She's going to be speaking about her experiences. And she's a very inspirational woman. She's a survivor of breast cancer. But not only is she a survivor, she's also an activist. She started her own organization called Better Days Breast Cancer Care. And she's got her own website, and it gives her a lot of information about breast cancer, a lot of resources and a lot of information. So it's a very good website, Better Days Cancer Care. So I'll be sort of talking more about the kind of scientific side of things, and Marina will be talking more about the personal side of things.
Right. And how old is Marina?
Marina I'm not quite sure how old she is, but she got breast cancer in her 30s.
Right.
So she probably was diagnosed about 10 or so years ago, 10, 20 years ago.
And she's completely cancer-free now?
She is not completely cancer-free right now. I think I don't want to go into too much of her personal issues, but I think it's recurred.
Right.
But she is a very strong activist. She's doing quite well. And she's really out there kind of being the voice for black women affected by breast cancer.
Okay. And the actual format of the event, are you going to be interviewing her?
So she's going to be speaking for a little bit, and then there'll be a Q&A with her. And then I will be giving a presentation around what actually is breast cancer, because people hear the word and they're not entirely sure exactly what that means. So I'm going to really break it down into what is cancer, what is breast cancer. I'm going to explain a lot of the terms that we hear about aggressive cancers, what stage cancers are. I'm going to go into all of that, what treatments are used. And then I'm going to focus a little bit on, not a little bit, a lot on how breast cancer affects black women, why there's this difference between our survival rates between white women and black women. So I'm going to explain a bit of the biology around that. And then, of course, I want everybody to be proactive, because obviously the key to a good outcome in breast cancer is catching it early, knowing what the signs and symptoms are. So I'm going to touch on what the signs and symptoms of breast cancer is, encouraging black women to do their monthly breast self-examination, and also looking at what possible the risk factors are, so people are aware of what the risk factors are and what they can try and do to reduce their risk. So I'm going to go through all of that.
And what's your background, Abby?
So my background is I'm a biologist, I'm a biochemist. I've got a bachelor's in biochemistry and a master's in biochemistry. I worked for the pharmaceutical industry for about 5 years, and I worked in the lab looking at cancer from a tiny little biological level. I currently now work for a cancer charity as a project manager.
Right, so, okay. Yeah. If you just tuned in, welcome along. I'm in the studio talking to Abby. I won't pronounce her surname. And we're talking about breast cancer within the African and Caribbean community, especially with women. Because, men do have breast cancer as well.
Yes. About 1% of cases are male breast cancers.
Yes, indeed. But we're obviously concentrating on the women. So we'll talk some more to Abby after this.
Oh, na. You gotta be a soldier. You gotta fight on, yeah. Do you think I'm gonna stand by and wipe the tears from my dreary eyes? If you think you got to move on, do what you gotta do and leave this alone, yeah. There's no time for moaning and groaning. We're big people, we've got to be strong. Life goes on and on and on. Leave me alone, I'm a soldier, don't you know? As the world keeps turning, got to hang on. So our lives keep changing. Change for the better. And as we keep on moving, life must keep on grooving. You make your friend, them I tell you if you do. Like a them, I go live your life for you. You better know just where you are go do. When the attack clocks turn round on you. Sometimes you want to have your own way. Next thing you know, your whole life gone astray. Take my advice and do the things that's right. Dash away the madness and make your future bright one day. As the world keeps turning, I know, yeah. So our lives keep changing, yeah. As we keep on moving, yeah. Life must keep on grooving. I know, as the world keeps turning. So our lives keep changing, yeah. And as we keep on moving, life must keep on grooving. Groove on, groove on. Got to be a soldier. Wake up and do the things that's right, yeah. In a time, judgment time. There's no time for moaning and groaning. We're big people, we've got to be strong. Life goes on and on and on. Leave me alone, I'm a soldier, don't you know? You make your friend, them I tell you what you do. Like a them, I go live your life for you. You better better know just where you are going to. When the attack clocks come turn round for you, what that thing, yeah. The world keeps turning. You gotta be strong. So our lives keep changing. Changing all the time, yeah. As we keep on moving. Life must keep on grooving. I know that as the world keeps turning, we must move along, yeah. So our lives keep changing.
Freddie McGregor right here on Colourful Radio.
And as we keep on moving,
world keeps turning. I tell you what, Sister Abby's bopping up and down in her chair there. You're loving that tune, aren't you?
I was enjoying that. It was really cool. Thank you.
If you just tuned in, welcome along. It's 11:23 right here on Colourful Life with me, Rosemary Laye. In the studio, I'm speaking to Sister Abby about an event taking place this coming Saturday called Breast Cancer and Women of African Descent. And of course, you know, the whole event is talking about how we can prevent it and how we can detect breast cancer as well. And interestingly enough, Abby, I heard that there's only been one study on how cancer affects black women in the UK.
Yeah, there hasn't been a lot of work looking at sort of breaking breast cancer down into ethnicity. And there was one study that was conducted looking at women in Hackney and breast cancer and comparing how white women were affected and black women were affected. So that was an interesting study, and it basically showed what they've been seeing in the US, which is that black women are less likely to get breast cancer. Mm-hmm. They tend to get it at a much younger age, and it tends to be a lot more aggressive. So they sort of confirmed what we suspected because of the studies that have been conducted in the US. Mm-hmm. So the US experience is probably going to be very similar to the UK experience.
Yes, it will probably reflect that.
Yeah.
So, I mean, you spoke briefly about what you're going to be covering on Saturday. And I believe that you're also going to be talking about what we can do to reduce our risks as well.
Yeah.
Yes? So can you just give us a little insight into that?
Yeah, so I'm going to cover on Saturday what we could try and do to reduce our risk. So the risk factors for breast cancer, they're a bit complicated, and sometimes it's hard to identify a specific risk factor because there's so many things that contribute. So the major risk factor for breast cancer in general is a woman's lifetime exposure to estrogen. Mm-hmm. So basically, if you've been exposed to a high lifetime exposure of estrogen, sort of increases your risk. So what we mean by that is that you then have to look at what it is that is exposing you to estrogen. Mm-hmm. So naturally, obviously, what exposes us to estrogen is when we start our period and when we stop. That's one of the first things. So they found that women who started their period at an earlier age, so kind of maybe before the ages of 12, were slightly increased risk of developing breast cancer.
Interesting.
Because obviously, if you start your period, say at 11, and somebody else starts their period at, say, 12, mm-hmm. they have a whole year more exposure to estrogen. Yes. So then on the other side of that is then when you then go through menopause, so the age at which you go through menopause. So women who go through menopause at a later age are slightly increased risk because obviously they've had those extra years where they've been exposed to estrogen. Yep. So in terms of prevention, there's nothing much you can do about that except to say that for what we can do for our future generations. So in terms of the starting the period thing, they found that stress and diet is associated with what age you start your period. So they found that young ladies that were very stressed, that were on quite a high fat diet and that were obese started their periods at a younger age. Mm-hmm. So in that sense, what we could try and do is just make sure our young girls are eating well and they're not stressed. Mm-hmm. So that's one risk factor. Another risk factor is our reproductive habits. And this is the most significant. So they found that if we change our reproductive habits, we could probably cut the breast cancer cases quite significantly. So they found that women who delay childbirth, so who start having families after the age of 30 with an increased risk of developing breast cancer. Increased risk. Right. Again, because when you're pregnant, your estrogen levels fall, mm-hmm. and so so that's protective. So if you haven't had any children, or if you delay having children, it slightly increases your risk.
We're not advocating teenagers.
No, we're definitely not advocating teenage pregnancy because they also found that if you start having your babies at quite a young age, that increases your risk as well.
Right, so you can't win really then.
Well, you just want to be, moderation. Right. Another risk factor is breastfeeding. That's quite significant. So they found that women who breastfeed reduce their risk of developing breast cancer. So the longer you breastfeed, the more of your kids that you breastfeed, that reduces your risk.
And
as
why
well.
Is that one?
Same kind of thing when you're breastfeeding. It's all to do with estrogen levels. So our reproductive habits really play a major part. Another risk factor is being on the pill. So a lot of when you are on the pill, some of the pills anyway, contain estrogen.
Yes.
So they found that women who were on the pill, especially the pill that contains a bit of estrogen, their risk was increased slightly.
You can get the high estrogen and low estrogen.
Well. So you just need to be aware of what you're on, what you're using. Hormone replacement therapy, which is used to kind of treat the side effects of menopause, that's been known to also increase your risk of developing breast cancer. So we're just recommending that people probably just don't take it. And they're, natural options or alternatives to hormone replacement therapy, which is literally just looking at your diet, et cetera, exercising. Yeah. Obesity is a strong one. Obesity is also linked to breast cancer. So, trying to maintain your weight. Alcohol is also associated with breast cancer. And also, alcohol, I'm trying to think.
See, with all these things, it's all about lifestyle, anyway, isn't it?
It's definitely about lifestyle. It's about lifestyle.
We really have to take care about that. When we mention stress, even stress will have a knock-on effect for high blood pressure and strokes, So we just got to take it easy. And look after ourselves.
Eat well. Make sure that you're, because our breasts have been used for a particular purpose, been made for a particular purpose, which is to nurture and to give life. And unfortunately, a lot of us are not doing that, and that's affecting our breast health.
So, you spoke about you be covering, how we can actually go through early detections. Obviously how we actually check ourselves on a regular basis. I can well imagine that there'll be so many women who are too afraid of actually, checking their breasts or examining their breasts. And I can also imagine a lot of women will think that anything they feel is a lump.
But
so that you think, well, I can't do it then. Because I'm gonna find something. I'm gonna definitely find something. You know what I mean?
Yeah, the only thing I can say about that is that definitely people shouldn't be scared about doing their monthly breast self-examinations. First of all, a lump doesn't necessarily mean it's breast cancer. It could be something that's benign. It could just be fluid buildup. So it doesn't necessarily mean that you have breast cancer. But it is important to really do your breast self-examination once a month. It's recommended that you do it after your period because, during your period, your breast can become a bit lumpy and also a bit painful. So all that's normal. But if those kind of lumps and things persist, then that could be a sign of breast cancer. But there are other sort of visible signs. So things like just one breast being larger than the other, a retracted nipple, so which is where like the nipple just looks like it's been sucked in. Yeah. Changes in the texture of your breast as well. If they become look a bit inflamed or pits and stuff like that, that's an indication. Obviously, if there's a blood discharge from your breast, that could be a sign.
No.
Yeah, that's a sign.
Even if that's not breast cancer, that still tells me that's not good.
That's not
good at all.
And obviously, the lump is the most common kind of sign of breast cancer. And as I said, it's recommended that you do this once a month. You need to do like a visual exam of your breast, know exactly what is normal to you. Yeah. Do a visual examination and a physical. So physical in terms of feeling for the lump and visual in terms of seeing if everything looks right. So you need to be doing that once a month.
So Sister Abby will be telling all of us this coming Saturday and plus many more. I think you'll be going also through you've mentioned the signs that ensure early detection and information, how difficult it is to actually access information and where we can get information from. You said about, the risk to how to reduce your risk. And, there are several things that you're going to be covering this Saturday. I know it starts at 3:00 and it's for 2 hours.
2 hours.
Tell us where it's actually going to be taking place.
So it's going to be taking place at the Roxy Bar, which is 128 Borough High Street. Nearest tube station is London Bridge Tube Station. We encourage everybody to come down, women especially, but men can come as well, just so that they have the information so that they can pass that on to their significant others, daughters, etc. Yeah. There is a charge of £5, which is payable on the door. And if you want any more information, you can look at blackhistorywalks.co.uk.
Wonderful. Sister Abby, thank you.